Hello, good afternoon, and welcome everyone to the sixth and final module of our webinar series on facilitating large-scale change. I'm Ian Smith. I'm a Programme Lead for Improvement Methodology in NHS England Sustainable Improvement Team. I am again, and for the last time, MC and host for today's webinar. There are other members of the Sustainable Improvement Team online today as well. Keeping an eye on the chat box, we have Georgina Hamill and Elaine Bayliss. And once again, looking after all things technical for us, we have Claire Potts and Linda Todd. Please do get in touch with either Claire or Linda in the chat box if you need any help or support, particularly with getting connected with sound. And joining us today to lead the session are Liz Maddox-Brown and Rob Coburn, again, both senior improvement managers within the Sustainable Improvement Team. So Liz has over 30 years experience in both public and commercial sectors, specialising in organisational change and improvement. Her work in the NHS has focused on facilitating change at national, regional and local level in both provider and commissioning organisations. And her current portfolio focuses on network development and spread of continuous improvement. Rob, he also has experience across both public and private sectors, as well as in the third sector, where he's worked as a manager and leader of change. And before joining the NHS, Rob worked with the European Commission and the Scottish Office to develop networks and has led one of the first social enterprises in Scotland, developing a network of training hubs. So Liz and Rob will lead today's session, which will focus on creating and managing networks. So without further ado, I will hand over to Liz Maddox-Brown to get us underway. Now, it does look like Liz may have lost some sound there. I think Liz's audio may have dropped out. I don't know, Claire or Linda, if we could get in touch with Liz via chat or email to get her sound back up. I wonder if Rob might step in to Liz's shoes to get us underway. Is that possible, Mr. Colburn?
It is indeed, as soon as I unmute myself. There
indeed. We go. If you would like to take us away while we try and get Liz back.
Hi
hello,
there.
You are. There we go.
Nope, Liz is back. Right, I'll go mute.
Okay.
Apologies.
Over to you, as many sounds.
Yeah, I just suddenly got lost audio there for some reason. Anyway, thank you for the introduction, Ian, although I didn't hear it, but I'm sure that was
it was very good. Spoke very highly of you.
Yes, yeah, okay. All right. Well, thanks very much. And go straight into our session then. So I'm sure you'll have gleaned a lot from your 5 webinars to date, having been part of the workshops and also listening to the webinar series on a couple of occasions. I know that there are lots of concepts and tools and methods that you're now familiar with. And what we want to do today is to explore how those concepts, tools and methods fit or not, you may decide by the end of the webinar, with network forms of organising. So the objectives for this session are to describe the varying forms of organising for large-scale change. So you're thinking about different models and approaches. We're not going to touch on all of the tools and methods you've worked through so far, but we're going to be focusing pretty much on network organising, as you would expect. We're then going to be sharing with you, if you haven't already discovered it, the Source for Networks platform, and the wealth of resources that sit on that platform and connections that you can make to help you really get ahead of the game with your network organising and help you to build your knowledge and skill in establishing and developing and strengthening your network. And then finally, as a result of all of that, give you the opportunity, not on the webinar today, but hopefully with a future access to the platform, opportunity to build a plan in a better informed way to strengthen your network. So first of all, we just wanted to recap on several of the key tools and models that you've looked at over the course of the webinar series. And I think you'd probably agree that sitting at the heart of the successful implementation of these tools and models are principles of co-production, partnership, collaboration, all of which sit very much in the domain of network organising. And again, when you've been exploring, so based on those tools and models, what are the relational skills that we need to drive large-scale change forward, whether that be as a key leader, an opinion leader, or as a participant in a large-scale change project. Again, I'm sure what you've probably reflected on and discovered, it's all about what's being called now as relational intelligence. We've had emotional intelligence, we've had, QI, but this is all about who do you know? And often it's the way that things get done in a system, isn't it? It's the way that you influence, it's who you know, it's the way that you traverse the professional walls and hierarchical ceilings that sit as part of our system. Because often it's the hierarchy that isn't working for us. So we kind of circumvent it and go straight to the people that we think can help us. So this again all sits very much at the heart of network leadership. And when I use the term network leadership, I'm not thinking about that there is one person in a network that is performing or holding the leadership role. It's about really how you engender something called distributed leadership across a network and empower all members of your large-scale change team to take forward the actions that they know they need to take forward in order to influence and make changes to the system. So it's the way that things often work. But before we get started, over to you really. It'd be really good to see what you're curious about today in relation to networks and your large-scale change. So can I encourage you to use the chat space? You've been through, you've used that quite prevalently before. And what I would say to you, please, is be very relaxed about typos. Just get your thoughts down. We can all recognise the words. And also, if you've got questions, don't hold back, because it's often a kind act to put a question in the chat space, because I'm sure if you've got it, others do, and they may not feel as comfortable to ask the question. So if you could just pop in there, what are you interested in? Okay, so we've got people, how to network effectively, so looking at networking skills, how to get people to network better. Just come over to mitigating complexities and pitfalls of networking for people who hate it. Yes, we know a few of those. Legalities, accounting and structures. Okay, so the really broad range of interests here, and what we'll be doing today is going over some of the principles and theories at a high level. But I would encourage you, for those of you that have got some sort of deeper questions, to visit the Source of Networks platform, because there's a learning space there, which has got great articles on all of the questions that you're asking here, and also a resource space that holds also articles, blogs, and case studies. So again, distributed leadership, networking. So there's something specifically about the skill of networking, which we won't cover in depth today, but I know it's an area of growing interest. How do you actually network efficiently as a professional? So great, okay. So moving on then, so let's look at, in terms of some of the questions that you bring, the context that we're working in. So I'm sure, you would probably agree, if you have a look through some of the major documents, policies, guidance and literature that surrounds and directs the health and care services, the ambitions that sit within it for the delivery models, the leadership values and skills and approaches, it's really interesting to see how for our new healthcare system, not only to survive but to thrive, networks will need to play quite a key part. And also the skills of working within a network and network leadership. And we see words that really clearly indicate this in all of these documents, like integration, collaboration, partnerships, etc., etc. So really setting out there that in order to survive, we've got to think outside of our own closed boundary and across the piece. And again, you will have covered this at length in your large-scale change webinars. So again, thinking about, so that's the policy direction, and why is that policy direction being set in that way? Why are those terms being used? And again, I know that you've covered the concept of wicked problems within this webinar series, which are actually a bona fide problem typology, and a guy called Keith Grint has written a lot about wicked problems and clumsy solutions. And, you know, wicked problems are problems which don't have a known solution. They're often intractable, and they really require people to come to work together on an equal footing, engender high levels of trust, reciprocity, mutuality, in order to test and experiment and push the boundaries to find new solutions. So it's not just about old wine in new bottles, it really is about new wine and new bottles. And, you know, when networks are working really well, they engender all of the conditions that enable that to happen. If we think about the hierarchies that we belong to, often, you know, we are constrained by roles that we play within a hierarchy. We're also in a kind of line management arrangement and dynamic where often we feel not able to share our views and our voice and to test and experiment with limitation on risk. And that's what networks are all about. So we've got the nature of policy, we've got the nature of the problem. We've also got some of the tensions and transitions and challenges that exist within our health and care system. So we know in order to effectively embed large-scale change, we need to be moving from the list of conditions that sit on the left-hand side of this slide across to the right-hand side. So we need to be really engendering principles and ways of working that work from the outside in. And if we have a look at some of the really high-performing healthcare systems across the world, Nuka in Alaska, if we look at Intermountain in Utah, and Buurtzorg in the Netherlands, we can see how those healthcare systems really are working from the outside in, positioning citizens and service users right at the centre as their common purpose, and working across very productively and very effectively organisational boundaries, sector boundaries, to bring to those populations the best possible care. Again, network principles. So, I seem to be stuck on this, can't seem to move, here we go. So, the dilemma though is, and I'm sure you've experienced this, I certainly have, and I know you've talked about it as part of or touched on it as part of the series, is, you know, how do we make this jump from what's being called the old world to the new world, old power, new power? And it's really quite a challenge, because if we look on the list on the left-hand side, there are some things that are really at odds with each other. So we are in a system that's experiencing increasing complexity. However, that in itself brings uncertainty, and when uncertainty kicks in, control tightens, and people become quite concerned with finding simple solutions to complex problems. So we're very much based still in a transactional world, even though the NHS that was founded in 1948 has changed significantly. You know, epidemiology, demography, ways of leading, ways of organising, and yet we're still struggling with this shift across to what the NHS needs. So, you know, the experience that you've had as part of this series will hopefully equip you with some ways of thinking and working to make that shift. So how did that then map onto the ways of doing things? Well, Professor Becky Molby and Murray Anderson Wallace, who have written much in the UK and internationally on networks and network forms of organising, they define the way of doing things under three categories. So they talk about do well, and this is where we think very much of a bureaucratical, hierarchical world, where the world is predictable. If we do X, we'll get to Y, and highly controlled. Then they talk about doing things better. So this is very much where the improvement world kicks in, where the principles of the change model are really helpful in making incremental change. It's often not very quickly. It doesn't happen particularly at a rate, but it is about planned, reviewed, and thought through iterations and incremental change. And then the next world that the next way of doing things that we often experience is doing things better. And this is absolutely the network space. So this is the relational world, the co-produced world, where networks really provide the vehicle to support learning and the spread of doing things better and strong ways of collaborating. So I'm just going to pause here and ask you to put an arrow where you currently think your large-scale change fits. So which way of doing things currently fits your large-scale change effort? And this is where you should now see some annotation tools on the left. That's excellent, great. So quite a few there in the improvement world. Do grab an arrow and click and give a few more minutes. Okay, so sort of a tendency, a bit of a pattern there, more on the left-hand side. Oh, Rob, good old Rob, Carolyn Holmes. So if that's where your current large-scale change fits, or your large-scale change approach currently fits, if you think there needs to be a change to that, please now grab your arrow and move it to the one way of doing things where you think it would really make some great and significant changes to the way that you deliver your change. So, yeah, okay, moving across there. So really, really interesting. Again, looking in the chat space, lots going on there about distributed leadership, collaborative leadership, and the way that command and control often does kick in when the going gets tough and things become uncertain. I think it's a sort of an anxiety mechanism, wanting to make sure that things are delivered, but actually the toughest thing to do is to give over that control and let things emerge. But we know it's tough, so that's great. Thank you. So I'm going to move us on now. So you'll see that you're heading towards the network space, so that should be encouraging and interesting for the rest of the webinar. So I guess in a nutshell, this is the challenge really, isn't it? It's about how do we encourage professionals and managers in different organisations, in different positions, in different roles, in different hierarchies, to really rise above their own organisational and individual interests and coalesce around the common health and care needs and challenges as multiple agency workers. So this is it really. This is the large-scale challenge, and it's also the network challenge. So let's look at the nature of the work. So if we look at some of the work of LaRue, so you may have come across his work before. He's an organisational development consultant. He has spent quite a bit of time working with McKinsey and also internationally as an organisational change and system coach. And he categorises organisations and organisational organising into 5 key categories. So he talks about the red world. In other words, this is the conformist, the right and the wrong. And he talks about a metaphor with the army and a wolf pack. And then he talks about the amber world, which is very much the hierarchical world, command and control. Sorry, that's where the army metaphor comes in here. He talks about the green world, so the pluralist world, very much a focus on family and some good examples of organisations in this world of Southwest Airlines, Ben & Jerry's, and Michael West, who's written quite prolifically on teams and the benefits of teamwork. And then he talks about the teal world. So this is, I guess, the ultimate form of organising. And I mentioned Buurtzorg earlier, which is the health and care system within the Netherlands that has brought together teams of clinical peers to work together with local communities to make collective decisions. And this is very much a strong collaborative base of organisations. So I'm going to take you into a poll now, because it'd be really interesting to see which world do you think your current organisation sits within, in order to think about what does this mean for your large-scale change. So if I just recap, so the red is the chief and the foot soldiers, so gangs and mafias. The amber is the army, very hierarchical. The orange is the achievement-focused, questioning, companies like Coca-Cola, Walmart. Green is the pluralist or the family. And teal is the self-organising, flat, peer-informed, evolving organisation. So we'll just wait we've got a time limit there for 5 minutes, but I suggest that we just make that 2 minutes. So if you could just click on the zone or the letter that best reflects your organisation.
We're about halfway through participants loading in the results, Liz, so we'll just give it a few more seconds.
Okay, lovely, thank you. And just go to the chat space, actually. Rob, is there anything that Rob, Georgie, that you think we should be picking up in the chat space?
There's quite a few comments coming through in terms of the reporting systems. I think that was Sean who mentioned about governance. I think if I remember rightly, it was Leanne mentioned about actually getting other members to do some work, and it's because they don't. That's sometimes why networks fail. And I posted back to in both of those comments, basically saying they must be psychic because we're going to look at the maturity matrix later on, which covers these aspects. So I think there are aspects coming through which are really applicable to how you make effective networks.
Okay, lovely. Claire, are we able to put up the results of the poll yet? Or shall we come back to this one? Are you there, Claire?
It will take about 15 seconds to load up, so I'll load it as soon as it comes up, Liz.
Okay, all right. So we'll move on to the next slide, and then Claire, if you could give me the heads up when we're ready to go back to it.
Okay.
Okay. So we've so far talked about the nature of the policy and the way that networks and network organising is sort of scattered liberally throughout policy direction. We've talked about the nature of the problem. So we've talked about wicked problems. We've talked about some of the tensions between the old world and the new world. And we've talked about the three ways of doing things. So doing better, very transactional, doing well, which is very transactional, doing better, which is a world of improvement, and doing better things, which is absolutely the domain of large-scale change and network organising. So we're now going to move on to how do we actually organise our work. But before we do that, I can see there that the results
are ready now.
The results are ready. Okay, lovely. So, really interesting. That's what's really encouraging there is when we think about there don't seem to be any typical organisations that typically resemble the mafia, which is great actually. But we do seem to have quite a few there. Probably the bigger number of responses in the conformist right and wrong. I guess more of the hierarchical bureaucratic world, with some folks sitting in the sort of achievement-focused, questioning effectiveness world, which is also encouraging, and a few there in the green and teal. And I guess the opportunity here is to, as a community, and as you're growing as a community as part of this webinar series, to take some time to go to the collaboration space afterwards and just explore, what can you learn from each other? Those people that are in the teal world, there's five. I would say from orange downwards, there are about 24 folks that are sitting in more of the transformational world. So if you can connect on the collaboration space and swap and share ideas about how do you do this, what are you doing that we can learn from, that would be a really constructive thing to do. And then looking at the ways that we organise, typically, I mean, there are many books written on forms of organising, but typically we tend to categorize it into hierarchies, which we've talked about, which are very, they deliver solutions to tame problems. They're very predictable. X equals Y. Things get done effectively. It's objective driven, very much an uncontested route to achieving the solution. We talk about the adaptive world, which is the best way that I can describe it. You probably talked about complex adaptive systems, so I'm sure this won't be new to you. The Health Foundation have written some great case studies around adaptive systems and some literature and reports. And they describe the primary care system as very much a complex adaptive system. So always calibrating and recalibrating the way that it organises itself, the way it deals with new health and care issues, trends and demands, because it kind of sits between a number of players in the health and care system, from the very much front-facing care of service users through to secondary care, tertiary care systems. So, you know, primary care, great example of a complex system that is continually adapting. And then we have networks that sit almost not too far off the head and shoulders of adaptive systems, but are the places that really, when they are organised, because they do take organisation, can create great opportunities for cooperation, reciprocity, exchange, innovation, creativity. And what's really interesting as well is the way that knowledge management or knowledge as a core function sits at the heart of networks. So networks need to be a place where information is gathered, organised and made available so that people can really engage in their work in an effective way. So 3 forms of organising. So over to you in the chat space, if I may, and to ask you to think about and pop your answers in on these 3 questions. So what sort of work is best done through a hierarchy, what best done through a network, and what best done through an adaptive system? So just pop your answers in the chat space. Particularly those of you, if you're thinking back to the way that you rated your organisation, you know, what is it that currently holds you in that red space or amber space or green or teal space? Is it because you're really working with wicked problems and that they've got hits talking about culture there? Yeah, I mean, there's that old saying, isn't there? Strategy, no, culture eats strategy for breakfast. That's it. So no matter how well intended a strategy is, if cultural roots are very ingrained in a bureaucratic way, it's difficult to break through that hierarchy in government and simple decision making or budget setting. Yeah. Okay. So leadership, excellent lunch. Yes, excellent lunch. Yeah. So here's a link. Okay. So thinking, really important to think about, you know, starting to line up now. You're thinking between, you know, what is the nature of our large-scale change? Where does it fit in the way of doing things? Where does it fit in the way that we're currently organised to work that large-scale change through? And what kind of changes do we need to make, if any, so that things are better aligned? So context, systems, processes, culture. And one of the quotes that we've got from the chief exec we've worked very closely with throughout all of our work in developing network working, I think is really quite poignant and really worth paying attention to, because he talks about the both and. So some of you that might have worked with polarity management, you know, networks are great for providing those agile, rapid solutions in a complex environment, but actually we do have to work within the system we're working in. So we do need a formal hierarchy, but it's how do you straddle the two? And that's a real art, actually, and can be quite energy demanding when you're in a position of accountability, trying to manage both the requirements of a mandatory world, but also trying to engender the culture and ways of working that are necessary to bring about creativity and innovation and you know, large-scale, big-step change. So we're now going to think about 6 functions of a network. So those of you that are leading networks and were curious about your network and how you could make it more effective, Menzibar and Hearn talk about 6 functions of networks. They talk about convening, so bringing people together, the ties that bind based on common and shared values. They talk about the need for networks to amplify, so to give the network a voice in order to influence in a way that it couldn't do if it didn't bring people together in a network. It talks about facilitating, so making the work of network members easier by the way that the network functions and the resources and tools that it provides by investing and providing. And it also talks about convening, so having the license, which can often not exist within a bureaucracy or hierarchy, to bring together the rich diversity of players that's needed to actually bring about the best of change. So just interested if you could grab your arrows one more time and put your arrow on where you think your network, if you're in a network, or the work of your large-scale change team is strongest. Is it filtering, convening? Excellent. And none of these are right or wrong, and often, it's not right or wrong to have a strength. It's like all things. It's about aligning the strengths with the change that you're trying to bring about within the structure that you're in. And often a network can have several of these strengths, and that's a great space to be. If it's about, but it really is about thinking forward to that common purpose. What is this change trying to achieve? And therefore, where do we need to pay attention in our network to some of these roles and functions? I'm going to quickly move on now, thank you very much, to the next building block here around network typologies. Oh, thank you, Angela. You will have your chance in a moment to put an arrow on, so hold that thought. So we work with, again, quite a classic set of network typologies, recognising that, there's no really firm delineation between them, and often they can be quite a mix. But actually, it's helpful to think about what is our network trying to achieve, and therefore what typology of network have we got. So we talk about delivery and developmental networks that bring together experts to work across, to join up services and resources and work across boundaries. And often the strength of those networks is they bring together certain types of people called boundary spanners. We talk about learning and support networks, which really major on sharing knowledge, information, distributed leadership. These work really well whilst ever there is strong commitment and transparency between all members, but they tend to fail when participants stop sharing. You get just a few people that are doing the hard work, and people tend to get a little bit hacked off and stop contributing. So lots of energy required within these kind of networks to the commitment to the cause. And then advocacy and agency networks. These are very much about raising the profile of a particular cause or lobbying for a particular outcome or political big and small p initiative. And we've got some examples here. Again, these are up on the Source Networks platform. So the Mayo Clinic that has done some tremendous work in collaboration across a huge span of networks, bringing together over 5,000 clinicians across Arizona, Florida, and Minnesota. The Learning Network, the Co-Creation Network, which is up in Humber, Yorkshire and Humber, which again brings a really diverse range of clinicians and managers together, and professionals and academics and service users to consider and worry about certain aspects of how do we make services better. Great knowledge sharing going on in that network. We've got the Future Finance Network, which brings together quite innovatively finance managers and clinicians to look at how financial decisions can be made more effective. And then the Parkinson's Network, which is really, it just brings together members to support them, but it's really about raising profile and interest in a particular cause. So that is often agency networks are governed and they are fee paying, so members pay in. The two that we don't particularly work with are things that we class as managed networks and social networks. So a little bit about managed networks. So the health and care system calls lots of things managed networks, but actually they are more like programs and projects and can be clearly recognised by the way that people meet, often around a table with an agenda, and people are tasked with doing certain things and led by a management team. So we don't consider that fits really in the network domain, but it is a form of organising. And then social networks, which are great at gleaning information, generating interest and energy, and also really valuable to wrap around those other three forms of organising that I described, but in themselves don't have a particular common cause that people come together to work together on. So I'm going to ask you now just to grab your arrows and just pop an arrow on the network that you think would best support your large-scale change, or that you have in place to support your large-scale change. Learning and support networks, excellent. So quite a few there, they've got agency and advocacy, so delivery developmental. Great. So, and again, you know, I will keep repeating this. It's no right or wrong, but it's getting that alignment from the problem, the type of way of doing things, the environment and culture that you're working in, and the type of network then. So can you span across more than one? Yes, you can, Sarah. And the art is really to spend time considering in your network, which Rob will talk about, what kind of network are we, so that we can become quite focused. It's almost like, what kind of car do I need? You know, is it a Rolls Royce? Is it a Mini? Is it a four-wheel drive? And then aim to get that to be the best model that you can. Okay, lovely. So I'm going to move on. Conditions for networks to survive and thrive. So just put your thoughts in the chat space on what you consider to be the conditions to make networks survive and thrive. Can't see any chat coming up there. New ideas, trust, relationship, excellent, community, honesty, democracy, integrity, yeah, energy, fabulous. So these absolutely sit at the heart of high-performing and effective networks. Great. So I'm just going to share with you then what are some of the factors that really distinguish and cause networks to thrive, and much more written on this in our on our website. But they need to be innovative, they need to have distributed power. All of the factors that you can see just there are really, really important. So in particular, one that we discover time after time is quite key is engendering distributed leadership. And the large-scale change dimensions that you'll see now on your screen are absolutely underpinned by principles of network working. So pervasiveness really requires great levels of distributed leadership. Depth is about how do you bring people together, how do you really connect people, and size as well, scale. So not just one group of people from one domain or discipline, but multiple agencies to really get size and scale. So just to finally finish off, you'll see here that there are many functions or many principles that underpin effective networking, and you will be familiar with the change model, and many of those principles, and I'll just flick back again, are quite visible within the change model, not least of all in leadership by all, motivate and mobilize, measurement, so making sure that people understand why the network exists and the values that it adds. And there are a whole raft of things that would cause a network to fail. I'm going to highlight for you the things that are most significant in network failure. So first of all, and you'll see this in the change model, common purpose. Do we understand why we're coming together? What's the value add? Over management, so actually managing to the extent where creativity and innovation is not able to exist. And also thinking about leadership, and we talked a lot about distributed leadership, and I know that you have throughout this series, but how do you move leaders on? How do you get changes in leadership approach? So I'm going to hand over to Rob now, who's going to walk you through the Sorter Networks platform, the tools and the approaches that you can take from that platform to help your network be successful and avoid some of these failure factors. So thank you very much.
Okay, thank you very much, Liz. Lots of chat going on, and hopefully we'll be able to show you how the Source for Networks platform can perhaps help you answer some of the questions that you are struggling with in the chat box. So it's about setting up and strengthening the value and impact of your network, and we have a platform specifically designed to enable that, which is purposed towards the development of effective networks. And in fact, the course that we're about to launch in January is titled Developing Effective Networks for Change and Improvement. So the Source for Networks website supports that network growth and development and supports the leaders. And whenever I say leaders, please read distributed leadership, because that's the way we see it within the network world. It's not a single leader, as has been said very clearly before. So it is that distributed leadership. So it's helping that leadership build the know-how by providing evidence, knowledge, learning resources. Very critically, we actually have a set of health check diagnostics, some tools that can help you look at how your network is functioning and identify where you might want to focus to improve that functioning. And it also provides a community space where network leaders can connect. And there were some comments in the chat box about trust, etc. And, you know, being able to connect in a safe space. And I responded to somebody saying, you know, I need to be able to, if I'm looking at trying to develop a network, I need to be able to test my thinking with other people rather than have the answer, but I need the trust and the safe space to do that. And that's one of the things the Source for Networks can provide. So this is the front page of the website. We launched a little over a year ago now, and we currently have nearly 1,300. I'm probably hit the 1,300 by today, I would think, because that slide was put together a few days ago. Lots of revisits to the website over the period we've been open. We've got 1,365 or nearly 1,400 actual people registered on the site and some 58 to 60 networks registered. We provide some focal point sessions, and I mentioned in the chat box about the one that we've got coming up in January, being delivered by Grace Sweeney from the Sustainable Improvement team, looking at how you can actually measure the impact and value of your network process. So do look out for that. So a very well-resourced, well-structured platform. It's based on an evidence base. So, you know, not just on some of the literatures. You can see Networks in Healthcare, which is the book that Becky Mulvey's written. And Becky we work with very closely because London South Bank University, where she is a professor, is actually our collaborator on the platform, sourcing it for us and providing the many of the resources on there. But we also look at some of the research evidence from the Health Foundation, and obviously we look at other developments within the network world, such as Connecting to Change the World. Interesting book there, Collaborating with the Enemy, etc. But the basis of the tools that we use, the diagnostics that we use, is the Health Foundation Effective Networks for Improvement. And that looks at developing that picture on the front, which is the 5 C's, that looks at, again, common purpose, that cooperative structure, the critical mass, the numbers, so that there are sufficient people carrying the burden, that community building, and the collective intelligence or the knowledge basis that comes behind that was mentioned. And what we've done on the platform is we've also built a number of case studies from network leaders who went through a development program some years ago and then used the tools and techniques within their own networks. And we have case studies, we have some PDFs, and we have some very short video vignettes of them talking about what they learned from the resources and support that they got. We have a suite of diagnostics, and this is, if you like, the jewel in the crown of the Source for Networks platform. It's quite unique to have these diagnostics and also have them available to be used online. So they are evidence-based, and as I mentioned, it helps networks look at their development needs. So where are they? Where would they like to be to improve their impact against that stated purpose, that common purpose that they have created collaboratively between them? It provides a process to feed back to the whole network, and obviously in large-scale change and the change model, one of the things that's talked about is engagement with others. So by having that ability to feed back, we've used these tools in workshops, and the discussions and aha light bulb moments that come from that actual talking round where people see the network and where they would like it to be is quite fantastic at times. And it's a systematic process that can be repeated over and over again. So, you know, you would do it when you set your network up, see where you are, see where you'd like to be in 6 months or 12 months. Do it again at that point, see where you'd like to develop over the next period. Because networks aren't static beings. They are constantly shifting creative organizations when they're working well. So doing that systematic check is very, very useful because it's easy to lose sight of where you really are rather than where you actually think you are. And as I said, it's that framework for a very robust conversation to get that shared understanding, that real agreement on where the network is and where it's going. So the suite of tools, there's 3 in total. We have a core questionnaire, a maturity matrix, and the health check scorecard, which is where that sort of feedback from the whole membership comes in. A quick screenshot of those, so just so people know what they look like. So if we look at that core questionnaire, that starts off, sorry, wrong slide. The maturity matrix is where we look at the 8 dimensions of the effective network. So we have 8 dimensions running across the top of the matrix, and we have 5 levels. And many of the things that have been looked at in the chat box about, you know, having that common shared purpose, they appear in the matrix as a dimension. There was the comment about the governance and, you know, how members contribute. So this is also, you know, this is not just the governance externally on the network, who are you reporting to, et cetera, but how you actually operate as members and core leadership of a network. What are your responsibilities? What should you be doing? How do you share your information and knowledge? Where does that leadership and the facilitation of the network come from, and how is it functioning? How do you look at the knowledge capture? That integrity of the network and the maintenance of a dynamic, vital network rather than something that the last post on the website was 2 years ago. How do you share the knowledge for learning and improvement? I do apologise, I have a dog barking in the background. They have been extremely good so far. Hopefully they won't cause too much disturbance. And then one of the issues that was also raised was the impact and value of the network. How do you show that in terms of external and internal reporting? And how do you sustain a network and renew its energy and vigor, or know when to finish the network? The tool is interactive on the site, and we'll give you a chart like this when you can complete it. So you can see large gaps here on the knowledge capture and reuse dimension and gaps elsewhere. So this provides you with a visual clue as to where you would like to see improvements take place within your network and which dimensions you should be looking at most closely. So let's just go back to the all-important one of the purpose. It's a very critical factor in large-scale change. It's a critical factor in an effective network. And it is about that, you know, why do we exist as a network? What is it we're actually trying to achieve in our large-scale change? And it should be put together in a way that brings people together and guides their actions. So it's almost like a sort of a mental check of, is what I'm doing in furthering this process actually achieving the core purpose, that central purpose of why we are. It's what anchors the network, and as Collins and Porras say, a good purpose statement should be broad, fundamental, inspirational, and enduring. So nice little quote there, motivation is found when the purpose is discovered. And we know that in many instances, real change takes place when people are committed to that change rather than actually just feel that they are, you know, it's part of the process that they have to go through. So here's an example of a core questionnaire. Looks at the purpose, looks at resources, looks at other factors within the process. And we have an example of one that's being completed by one of our network leaders on the Isle of Wight. So how this ties in with the shared purpose and the large-scale change, and any change process, in fact. What will it look like when you're successful? Obviously ties back in again to the engaging and connecting others within the large-scale change model. And this is the one that was completed by Murto. It doesn't have to be too extensive. It can be fairly broad to start off with, because you would use this to then discuss with your wider membership and to get their input, bring them on board. And there's a quick picture of Murto. Networks bring very different people together with different backgrounds and even professions to work towards a common goal, a key principle of networks. So what we'll do now is just look at that particular dimension on the maturity matrix, and you can access the matrix on the Source for Networks site. I think I've seen links go into the chat box as to how you can get this and download it. So we have the 5 levels there, ranging from the fact that there is no real sense of goal or plan. It's all about, well, we're here, so what? To the point where at level 5, the network is continually reviewing the strategic purpose and developing additional groups to cover different topics, because in many of these situations, there is no single theme, but there is a sort of, if you like, catchment that brings together a number of themes for that purpose. So again, using the arrows, perhaps you'd like to point to where you think you are with your, if you have a network, with your network, if you don't have what you recognize as a formal network, how do you think you as a team are positioned on this maturity matrix in terms of your purpose and direction? So we've got some coming in there, quite a lot of loose scoping, some with an agreed charter that states the purpose, and then interestingly some where members are clear about the purpose. So there is that difference between perhaps that agreed charter that is known by a few or by a group of people, but in terms of the overall network, if you think of your all-encompassing stakeholder group, then are all those people clear about what the purpose it is that you're trying to achieve? And very pleased to see Vivian there, where their network is continually reviewing its strategic purpose. And a couple where there is no real sense of goals or plans. So, you know, in terms of taking forward a change, if people don't know what it is that they're trying to achieve and don't have a plan to get there, then it's going to be very challenging. So that's quite interesting. Okay. So do we have any other offers of arrows coming in? While that's going on, perhaps we could have a quick recap of anything that's come up of interest in the, well, it'll all be of interest, but any particular points that have come up in the chat box. Over to Liz and Georgie.
Hi Rob, it's Georgia here. People are finding them very interesting, the slides. One question that just come up is how do people get the slides from today? Claire, do people get sent those, or do they go on the community space?
Yes, indeed. I've got a slide coming up in a few moments, folks, on where you can get hold of all of the resources we've used on all of the webinars, from the first one through to this one, including slides and recordings. So yes, that is that's the long answer to a short question, Georgie.
Bill, thank you, Ian. And there's a couple of people who are interested in the Developing Effective Networks course. I have popped my email address in there, so if people contact me after today, I'll send them the application form and we can pop them on the reserve list. But we are hoping to do to launch the course again after this one finishes in May, depending on how it goes. And then a lot of good feedback from the maturity matrix, so people finding that a potential helpful tool that they could use with their networks.
Okay. Do we have any last questions for Rob, Georgie, or Liz before we start to wrap up the session?
Okay. I'd just like to say really pleased that we have seen quite a few positive comments about the maturity matrix. It is a fantastic tool to use, and the conversations, quite often when you're in a room with a group of people trying to sort things out, unless you have a good clear framework to engender the conversation in the first place, then you sometimes get to the end of the day and you haven't really felt that you've tied things down, whereas this really helps you tie things down and gets people going out of the room with a real sense of purpose and direction, knowing what they want to do, and inspired to get on and do it. So encourage anybody who is looking at a cross-system network or an organizational change network, then please do go onto the source for networks and start having a look at these tools. Okay, over to you, Ian.
Thank you very much, Rob. I haven't seen any new questions moving. Could you just hand me the ball, Rob, so I could just move the slide on?
I hope I can.
There you go.
There we go. Yep.
Lovely. Thank you very much. So we've reached the last of our webinars on leading large-scale change. For those who have a thirst for more networks, which it looks like there are a few of you on the call today who do have a thirst for that, Rob, Liz, and Georgie and the team will be back in the new year with a focal point webinar on measuring impact of networks. I know we had some questions a little bit earlier on about return on investment and how we demonstrate and measure impact. That may be of interest to some of you. There has already been some discussion and conversation about the Developing Effective Networks program. Again, that launches in the new year in January. As Georgie says, I believe that that the course is now fully booked, but they are operating a reserve list if you would like to register your interest to join a future cohort of that course. And again, others who are interested in spread of improvement and possibly using networks and other tactics and techniques to spread improvement gains through systems. We also have our colleagues launching the fourth course in the Improvement Fundamentals program in January as well. The details for all of these on the screen, and I believe some of the details have gone into the chat box, which have clickable links if you want to follow up any of those opportunities. And on the question of slides and resources, if you have not yet joined our collaboration space on NHS Networks, the link there is on the screen. I think Claire or Linda will pop the link in the chat box shortly as well. All of the resources that we produce and use for our webinar series are on there. There are recordings of the previous webinars. A recording of this webinar session will go on there in the next few days, depending on how long it takes us to get the video downloaded and then uploaded onto the platform. So everything is there. Also, there are resources and slide decks for other sessions that we run on large-scale change. So please do register if you're not already. There are around 1,000 or so of us on that space, so it is a good place to connect and engage with others interested in large-scale change. As I say, everything that that we have is available on there for you. So the final thing to say is just to wrap up, that now brings us to the end of the webinar series on large-scale change. I hope that you have all learned something that will help you with your own change programs, and I also hope that you've enjoyed joining the webinars as much as we've enjoyed putting them together and delivering them. And I hope also that I might see some of you in the future. We go out on the road, many of the team, in the new year with our Masterclass Roadshow. So hopefully we will see some of you coming along to some of those, again, now fully booked sessions, but I believe that many of you have put in applications. So hopefully we can connect with you face-to-face in the near future. So that is all. Many thanks again, everyone, for joining. Have a great afternoon, and I hope you have a great festive season and that we can connect with you in the new year. And many thanks all. Have a great day.